Good day, guys. My name is David, and today we'll be talking about procedures that should be done before a bypass graft. Firstly, we'll talk about definition of a bypass graft. Now, a bypass graft can be defined as a procedure which involves taking a graft, which is a blood vessel, essentially from any part of the body, and taking this blood vessel and attaching it above and below the blocked blood vessel or the narrowed blood vessel in an attempt to restore normal blood flow in the patient. Now we'll talk about the indications. Now the most common indication is in coronary artery blockage. Now a bypass graft is used when the coronary arteries are severely blocked and there is a high risk of a heart attack. Also, it is also indicated in situations where the blood vessel that is blocked cannot be managed by medication, and the only option is to perform a bypass graft. Now, for the contraindications would be when a patient refuses to undergo a bypass graft. Another contraindication would be in situations where the blood vessel is incompatible with grafting. Another contraindication would be in cases where there is a heart valve disease or a blood disease. Now, one of the first procedures that will be done in preparing a patient for a bypass graft, and probably the most important procedure, is the preoperative teaching. Now, the preoperative teaching is very essential for this patient who is going to undergo a bypass graft, because a bypass graft is a very invasive procedure, and patients undergoing this type of procedures are usually anxious, worried that they might not make it, worried that they might be decapacitated in the future, worried that they might not be able to function normally after this type of surgical procedure. So it's very important that the preoperative teaching be done and be done very well. Now, what does the preoperative teaching entail? It entails telling the patient, and not just the patient's family members, telling them what to expect in the surgical procedure, telling them and explaining to them why the surgical procedure is the best bet for them, telling them about what they should expect in the post-operative period, what they should expect in the operative period as well, the duration that it would take for them to recover properly, things they would experience. All this is done as a form of emotional preparation for them, so they wouldn't be overwhelmed, and to reduce, very importantly, to reduce anxiety in the patient. Good morning, madam. My name is David, and today I'm here to perform what we call a preoperative teaching for you. I'm basically going to tell you about the procedure you're going to undergo. I'm going to tell you the benefits and the disadvantages of the procedure, and then I'll be able to answer any questions you might have. Is that okay, ma'am?
It's okay.
Okay, so basically the procedure you're going to undergo is called a bypass graft, and it basically involves us taking a blood vessel and essentially using that blood vessel to replace the blocked or the narrow blood vessel that you have. So is that okay? And then the advantages of this procedure is all the symptoms you told the physician earlier. You were complaining of shortness of breath, you complained of being tired all the time, you were also complaining of you complained of fatigue, you said you had pain. All those symptoms would no longer be there when we perform this surgery. Also, with this surgery, your blood flow will improve. Also, the chances of you having a heart attack after we perform this surgery will be much more lower. Would you like to know the complications of this surgery, ma'am?
Yes.
Okay, so basically we have one of the complications of this surgery would be an abnormal heart rhythm. We call this arrhythmia, um, and it is a complication. Also, another complication would be bleeding when we perform the surgery. Another complication would be formation of blood clots, and if these blood clots travel to your heart, uh, they could potentially cause a heart attack. If they travel to your brain, they could cause a stroke. If they travel to your lungs, they could cause what we call a pulmonary embolism. Okay, so another thing I'd like to tell you about this procedure is, with this procedure, you should be able, like after the procedure is done, you should be able to sit in a chair after a day. You'd be able to walk after 3 days. You'd be able to walk up and down a staircase after between 5 to 6 days. But after 12 weeks, full recovery should be made. Is that okay?
Okay.
Do you have any questions you'd like to ask me?
No, I'm okay with the explanation.
Okay, how are you feeling about this procedure? Aren't you anxious? Aren't you scared? I don't.
I'm anxious, but I believe I'm in safe hands, that everything should work fine.
Well, you have that much trust in your healthcare team.
Yes, I do.
Okay, that's very good to hear. But obviously, we as the healthcare team, we do our very best in ensuring that everything goes smoothly. And if perhaps you have any questions, you're always free to ask us. And we know that your relatives who came here with you, they are worried, they're anxious as well. But not to worry, we'll attend to them, we'll answer any questions they might have, so that will sort of relieve their anxiety, because anxiety is not good for anyone. Is that clear, ma'am?
Yes.
Okay. I'd also like to tell you about some of the sights and the sounds you might hear during the procedure. During the procedure, you might hear a humming sound produced from, the equipments they're going to be using. You might see, you obviously be under the effect of anesthesia, and you see couple of surgeons around you. An invasive line will be made on your chest, around your heart area, and obviously we're going to put you under anesthesia. So and we'll also give you tablets, antiemetic tablets. Will give you sedatives as well, and the duration of the operation is going to be about 5, 6, 7 hours. And in the post-operative period after the surgery, you would be with somebody who is a competent caregiver, and this person would be available to help you, to attend to you. And in the after the surgery, we're here to help you. We don't want you to be scared in any way. We're here to try our best and attend to your very needs, whilst trying to prevent complications and anything that might develop. Okay? Also, I'd also want you to know that after the surgery, maybe when you wake up, you might notice a tube that is inserted. We call it an endotracheal tube, and you might not be able to talk. So I'd want you not to worry, because it's all part of the procedure. And also, it's going to be removed when it's no longer necessary. Is that okay, ma'am?
Yes.
Okay. Also, I will have someone coming after me. The lady who's going to coming after me, she's going to help you practice with some of the instruments and equipment you're going to use after the surgery. We have this device we call an incentive spirometer, and it is used to prevent respiratory complications. So she's going to help you practice with it now, so that after the surgery, right, using it wouldn't be so difficult. Is that okay, ma'am?
It's okay.
Okay. What else do I want to say? So we're going to perform a couple of tests on you, okay?
Okay.
The first test we're going to perform is called a blood count test and hematocrit. And this test is basically, it will check if you are anemic, and if perhaps you're anemic, they'd give you to check if you have a low red blood cell count. And basically, if you're anemic, they'd give you medications that would boost your red blood cells. Is that okay, ma'am?
It's okay.
Okay. Uh, uh, a lab thing will be written for you, and you take, and then this test will be performed on you. Also, another test that will be performed on you, we call it a PT. It's called a prothrombin time and a thromboplastin time, PTT. This test determines your blood ability to clot. Yeah, so we need to perform this test on you, and maybe in case you've been taking blood thinners in the past, right? We just want to know if your blood's ability to clot isn't impaired in any way. Do you get me, ma'am?
Yes, I do.
Okay. Other blood tests will be conducted to assess your kidney and liver function, and then a chest X-ray will be done, ma'am. Do you get me?
Yes.
This chest X-ray is used to check the size and shape of your heart, aorta, whether your lungs appear normal. Is that okay?
Yes.
Okay. Then a cardiac catheterization might be done. This is to picture your arteries and to locate where there are blockages. Is that okay?
Yes, it's okay.
Okay. Thank you very much for your time.
Thank you.
Please feel free to ask me any questions. We are here, and our utmost priority is to attend to you. Do you get me, ma'am?
I do get you.
So now I'm going to head over and have a conversation with your relatives the same way I've tried to allay your fears and worries. Even though you didn't have too many, you seem very confident in your healthcare team. I'll try to do the same for your family members and relatives. Thank you very much for your time.
Thank you.
And I wish you the best in your upcoming procedure.
I thank you very much. I appreciate that.
Yeah. Good day, madam. How are you doing today?
I'm fine, thank you.
Okay, ma'am. My name is David, and I'm your nursing assistant for today. What I've come to do here is to fill up this chart and to see if you've completed all that you need to do so that you can undergo this surgery tomorrow. Is that okay with you?
It's okay.
Okay. So, ma'am, I'm firstly going to ask your name. What's your name, ma'am? What's your name, ma'am?
Lizzie.
Lizzie. And how old are you, ma'am?
42.
42. Okay, you are a female. You're in Unit 8, Ward number 29. Now, do you know the procedure you're going to undergo tomorrow?
Bypass.
Okay, it's a bypass surgery. Is it okay if I see your ID band, ma'am?
Yes.
Okay, check. Ma'am, I'm going to ask for your informal consent. Your informal consent is also your verbal consent. Do you agree that you're in a fit state of mind to undergo this procedure tomorrow?
I agree.
Okay. Ma'am, is it okay if I see your receipt for the payment that was made?
These are the receipts on the table.
Okay, thank you. I will check your file for allergies. On your file, it says no. May I see your nails, madam?
My nails are okay.
Okay, thank you. Nails are short. I'll check your file. It says you've been fasting for 2+ hours. Fasting 2+. Can you open your mouth for me, ma'am?
Yes.
Okay. Loose teeth has been removed. Okay, dentures have been removed. Can you stretch out your hand for me?
Yes.
Okay. I see no nail polish. Okay. Okay, no jewelry is on you. Okay, I see no makeup. Ma'am, were the following investigations done on you? You might not remember, but I'll check your file. Was a blood count done?
Yes.
Okay, a blood count was done. A PT and PTT. It's fine, I'll just check your file, ma'am. Okay, this was done, this was done, this was done, this was done. Okay. Ma'am, at this point, I'm going to check your vital signs. I'm going to check your temperature. Is that okay with you, ma'am?
It's okay.
Okay, check. I'm going to go ahead and check your pulse. Is that okay?
It's okay.
Okay, your temperature is 36.2. Your pulse is 17. Hey, sorry, your pulse is not 17. My bad. Your pulse is 80. Your respiratory rate is 17. Your blood pressure is 121/82 mmHg. Ma'am, could you go ahead and stand on this for me?
Okay.
I just want to check your height real quick.
I will do just that.
Okay, we got 1.72. Ma'am, could you go ahead and take off your shoes for me and then step on that scale?
Okay, I'll do just that.
Okay, we got 76 kilograms. Ma'am, did somebody from the healthcare team come to visit you earlier on and educate you about the procedure you're going to undertake?
Yes,
Okay. Were they able to answer all your questions?
they did.
Okay. Do you have any other questions you might like to ask?
No, I don't.
Okay. Has the surgeon come to see you yet?
Not yet.
Okay, not yet. The PAC hasn't been done by the anesthesiologist yet, no? Did the nursing assistant come to wash your hair?
Yes, they
Okay,
came.
yes. Could you kindly open your mouth for me?
I did just that.
Okay, mouthwash has been done. Okay. May I observe your skin kindly, ma'am?
Okay.
Okay, correct. Okay, I'll check your file for the medicines, the preoperative medicines. Just right. Okay. Thank you very much for your time. I think you've been able to answer all the questions I want you to. I wish you the very best in your procedure tomorrow. Thank you once again,
Thank
and have
you.
a nice day.
You too.